The pain of endometriosis is etched on Sarah Lambrecht's face, her torso blotchy from the heat she uses to try to ease it.
It feels like I have shards of glass in my abdomen. Any time that I breathe or move or try and have a drink of water.
Covid pressures in hospitals delayed Sarah's last operation by 6 months. She needs another. No one can say when it will happen.
To not have any date that I can count down towards is very difficult, and it's very frustrating for the team that treats me as well, because they see how much I depend on their service, but they're completely inundated at the moment.
The latest figures show 5.7 million people in England were waiting to start routine hospital treatment at the end of August. That's the highest since records began in 2007. Nearly 10,000 have been waiting for more than 2 years. That's tripled since April. Wednesday's budget will attempt to address the backlog.
We're going to announce a fresh new £6 billion of capital investment into buildings, into beds, equipment and IT, into things like over 100 new community diagnostic centres that will mean more scans and tests and checkups being done.
44 of the diagnostic centres have already been announced, but the government says the rest is new money, and it'll top up £12 billion a year to be paid for by a rise in national insurance. But analysts worry one major issue still hasn't been addressed.
What use of facilities and equipment if you haven't got the staff to operate them? And we know the NHS went into the pandemic already in a workforce crisis, and it's still in a workforce crisis. So I think that's ultimately the question. What's your plan, your workforce plan, to make sure these new facilities and equipment will be well used?
There are 93,000 NHS vacancies across the country, and the waiting list continues to rise, as do pressures on urgent care and mental health, among others. We will hear more details in Wednesday's budget. No doubt more questions too.